Good morning, everyone. I'm Nirju Thapa. I'll be sharing the clinical case of Mrs. Teresita Manalo, who is currently suffering from an embolic stroke. This discussion will examine the A to E assessment approach, highlighting the importance of this assessment in making clinical decisions within the acute stroke care environment. Additionally, I will describe 4 priority nursing interventions that are crucial for treating Mrs. Manalo's condition and examine 3 primary medications frequently used in embolic stroke treatment, highlighting the specific nursing consideration for each. Let's begin. Stroke is the second leading cause of death and disability worldwide, as we know. Even though stroke care has improved in high-income countries, overall impact of health is still rising globally. Therefore, with the right treatment at the right time, many people are able to recover from the stroke. Following the systematic A to G assessment framework, Mrs. Manalo maintains a clear airway presently. Nevertheless, given her Glasgow Coma score of 12 out of 15, speech difficulties, and diminished level of consciousness, there exists considerable risk for airway compromise. Consequently, continuous observation is required with readiness to provide airway support if her condition deteriorated. Kennelly et al. 2024. About her breathing, her respiratory assessment reveals important clinical concern that requires close monitoring and timely intervention. Her fast, shallow breathing, 26 breaths per minute, may signal early respiratory compromise. Burnett et al. 2022. Furthermore, stroke can disrupt the brain's control of breathing, leading to irregular patterns and reduce the airway protection. Although her oxygen saturation is 95% on 6 liters via Hudson mask, it's important to maintain this level to avoid hypoxia. Considerline 2024. Regular checks for a sign of distress like accessory muscles use or increased CO2 are essential. Ongoing chest auscultation can also help identify issues such as crackle, which may suggest aspiration or fluid in the lungs. Kennelly 2024. Mrs. Manalo exhibits tachycardia, heart rate 132 breaths per minute, and a hypertension BP 170/95, which suggests cardiovascular stress and a possible decrease in peripheral perfusion. Stroke Foundation 2024. According to the National Clinical Guidelines for Stroke, hypertension is a major significant risk for both the initial and recurrent strokes. However, lowering blood pressure too soon after stroke may compromise cerebral perfusion and lead to the adverse outcomes. Additionally, atrial fibrillation has likely contributed to the onset of her stroke by promoting clot formation, and ongoing presence of AF increases her risk of recurrence. Port and Matfin 2019. Also, symptoms such as cool extremities and pitting edema may further signify compromised circulation or cardiac dysfunction. Crute et al. 2024. So, careful fluid management is crucial. Positive fluid balance has been associated with an elevated risk of cerebral edema and poorer neurological outcomes. Martin et al. 2023. Mrs. Manalo neurological assessment showed a GCS score of 12 out of 15, which indicates a moderate level of consciousness impairment. She exhibited speech and slurred speech and left-sided weakness along with facial droop, pointing to a specific neurological deficit likely caused by her right-sided ischemic stroke. Her capacity to follow commands using her right side and the presence of equal reactive pupils suggests that her brainstem function is intact. However, there is no immediate indication of increase in cranial pressure. So that's from Jane and Iverson 2023. Mrs. Manalo's case, the exposure assessment reveals that she's afebrile, which is important for neurological recovery, and also she has no visible wounds or bleeding. The absence of external bleeding is very important when someone is on anticoagulation therapy, such as heparin. It's from MIMS 2025. Overall, this supports a stable yet closely monitored approach according to the acute stroke phase. I'm going to talk about the nursing intervention now. A high priority nursing intervention in managing the patient with embolic stroke is optimal positioning, such as placing the patient in a semi to high fallers positions with support to the affected side to prevent injuries and provide comfort. This also helps lowers in cranial pressure and keeps the airway open, especially crucial if the patient has a reduced level of consciousness. Julius Tutti et al. 2025. Continuous neurological observation, including monitoring of GCS, pupil responses, and motor function, are vital to identify a decline or worsening of neurological issues, which could signal increased cerebral ischemia or higher intracranial pressure. It's from Jurtis et al. 2024. Furthermore, ensuring that oxygen saturation remains at or above 95% is vital for adequate cerebral oxygenation and for minimizing the secondary brain injury. Stroke Foundation 2023. Moreover, close monitoring and management of blood pressure and heart rate are crucial to avoid the risk of hemorrhagic transformation and prevent the further embolic events. Sajul et al. 2023. Also, early intervention with medication is the key nursing consideration in stroke care. Therefore, thorough review of exact onset symptoms, accurate dosing, and timely documentation are critical to ensure safe administration of medications. From Stroke Foundation 2023. Additionally, nurses must activate the stroke facilitated stroke protocol, such as rapid response or code stroke, to begin urgent assessment and care to exhibit the symptoms of stroke. That's Batrick Zek 2024. I'm going to talk about the medication now. Altiplase, which is thrombolytic medication, should be given within 4.5 hours from the onset of symptoms. Before administration, nurses are required to evaluate the patient's neurological status, blood pressure, and coagulation parameters to identify any contraindication, such as active bleeding or recent surgical procedures. Thus, continuous monitoring of neurological status and vital sign is crucial throughout the infusion process and for a duration of 24 hours following the administration. Zhang et al. 2024. Altiplase is administered based on the body weight. 10% is delivered as an intravenous bolus over the course of 1 minute, followed by the remaining 90% infused over a duration of 60 minutes. This medication must be administered in a monitored environment with regular assessment for any alteration in neurological condition. It's from MIMS 2024. Side effects are the most serious risk is intracranial hemorrhage. Other potential side effects include hypertension and mild allergic reaction, bleeding, angioedema, anaphylaxis, and fever. It's from Reed and Nicholas 2023. For the heparins assessment, you have to be careful monitoring because of the bleeding risk. Baseline and ongoing APTT has to be monitored. Platelet counts and clinical signs of bleeding should also be monitored. It's also crucial to look for signs of heparin-induced thrombocytopenia, HIT. It's from Considine 2024. About its administration, heparin is administered through IV infusion with dosing typically based on weight and adjusted in accordance with the APTT result. To ensure precise dosing and avoid the infusion errors, administration should be done through an infusion pump following the aseptic techniques, and as a high-risk medication, verification by the two clinicians is required. It's from MIMS 2025. Its side effects are bleeding, bruising, renal disorder, headache, weakness, dizziness, allergic reaction, general disorder, hemorrhage. MIMS 2025. As metoprolol is a beta blocker, prior to administering metoprolol, it is essential to assess the heart rate and blood pressure. Hold the dose if the heart rate is below 50 breaths per minute or if the systolic blood pressure is less than 90 mmHg. Observe the high sign of bradycardia, fatigue, or indication of heart failure. Additionally, it may also have hypoglycemia effect in patients with diabetes. So you have to consider that too. And it's from MIMS 2024. Metropolis should be taken with or immediately following a meal to improve the absorptions and minimize the gastric discomfort. Extended release tablets of Metropolis must not be crushed. It's from the Considerant 2024. And its side effects are frequent side effects include bradycardia, hypertension, dizziness, and infrequently patients may report depression, fatigue, or bronchospasms, especially those with pre-existing respiratory issues. It's from Port and Martin 2029. Overall, the goal is to demonstrate how timely assessment, evidence-based intervention, and safe medication management contribute to better outcome for the patient with stroke like Mrs. Manilia. It's from Stroke Foundation 2023. Thank you everyone for your attention, and that's all for today. Thank you.